Se-Natal 19 is a multivitamin and iron product that is used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. It is important because it provides essential building blocks for the body and helps maintain good health. It is recommended to take 1 tablet daily, or as directed by your doctor. It can be taken with or without food, but it is best to take it at the same time each day to help remember. It is important to follow your doctor's instructions for the best results. Chewing Se-Natal 19 thoroughly and swallowing it is usually done once daily or as directed by a doctor. It's best taken on an empty stomach 1 hour before or 2 hours after meals. If stomach upset occurs, it may be taken with food. It's important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication because they will decrease its effectiveness. Take this medication regularly at the same time each day to get the most benefit from it. Some common side effects of Se-Natal 19 include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. Iron in the medication may cause your stools to turn black, but this is not harmful. Your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. While very rare, a serious allergic reaction to Se-Natal 19 can occur. Seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. Keep this product out of reach of children. If overdose does occur, get medical help right away or call a poison control center. It is important to take Se-Natal 19 as directed by your doctor. Typically, it is taken once daily or as directed by your healthcare professional. It is best to take this medication with food to help with absorption. Make sure to not take more than the recommended dosage, as an overdose can be harmful. If you have any concerns or questions about taking Se-Natal 19, speak with your doctor for more information. Before taking Se-Natal 19, it is important to inform your doctor or pharmacist if you are allergic to any of its ingredients, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems. It is also important to inform your doctor or pharmacist about your medical history, especially if you have iron overload disorder, a history of alcohol use or abuse, liver problems, or stomach/intestinal problems. If your multivitamin also contains folic acid, be sure to tell your doctor if you have a vitamin B12 deficiency before taking it. Additionally, if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, it is important to consult your doctor or pharmacist before using this drug. Before having surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, be sure to consult with your doctor before using this medication. When taking Se-Natal 19, it's important to be aware of any potential drug interactions. This means that the way your other medications work could be affected, or you could be at an increased risk for serious side effects. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. There are some products that may interact with Se-Natal 19, such as chloramphenicol and methyldopa. Additionally, this product can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's important to separate your doses of these medications as far as possible from your doses of Se-Natal 19. Make sure to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your brand of multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. It's important to be aware of these potential interactions and to seek guidance from your healthcare provider. If someone has taken too much Se-Natal 19 and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the United States, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's essential to take Se-Natal 19 as directed by your healthcare provider and never exceed the recommended dosage. It's best to take Se-Natal 19 with a full glass of water and at the same time each day to help you remember. Make sure to keep all of your medical and lab appointments. It's important to note that Se-Natal 19 is not a replacement for a healthy diet. It's always best to get your vitamins and minerals from the foods you eat. Be sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your doctor. If you forget to take Se-Natal 19 at your scheduled time, take it as soon as you remember. If it's close to your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to take Se-Natal 19 consistently at the same time every day for the best results. It is important to store Se-Natal 19 at room temperature, away from light and moisture. Avoid storing it in the bathroom, and keep it out of reach of children and pets. When it comes to discarding Se-Natal 19, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. It is recommended to consult your pharmacist or local waste disposal company for the best way to dispose of Se-Natal 19. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.